Busy Boxes, expert information on HIV and HIV testing. What is HIV?
HIV is a viral infection, a sexually transmitted viral infection, which is increasingly common amongst heterosexuals and gay and bisexual men across the world. And it represents a huge epidemic with something like 45 million people infected across the entire world.
Are there different types of HIV?
There are different types of HIV. There's HIV-1, which is by far the most common form in the Western world, or in the world, in fact. There is also HIV-2, which is restricted more or less to certain regions of West Africa. And the numbers of HIV-2 infection are very, very small indeed, although people do worry that the HIV testing will miss out HIV-2, but it doesn't do that.
Is HIV life-threatening?
HIV is a life-threatening disease. It's a very inconvenient disease for all sorts of reasons. But certainly in the Western world, then early diagnosis and early treatment are key. And if you're identified as having HIV, then certainly currently there isn't any particular reason, if you follow through with treatment, etc., why lifespan and life quality shouldn't be much as you'd expect anyway.
How is HIV spread?
HIV is spread predominantly through unprotected penetrative sex. By that I mean either vaginal or anal sex. Anal sex is more risky because the anus is more vulnerable to damage. People very often will worry that HIV can be spread commonly through oral sex. There is some suspicion that that is possible. The very good data, very good studies which have looked directly at that question, have failed to identify a risk there.
Can HIV be contracted through oral sex?
HIV can be contracted through oral sex, but in very particular and very niche circumstances. So there have been some very good studies where where researchers have looked at HIV positive and HIV negative couples living together and looked at the routes of possible transfer, and they failed to show that there's a link between oral sex and contamination. So the primary route of contamination is by unprotected penetrative sex.
What are the symptoms of HIV?
HIV symptoms can be many and varied. So very often people won't have any symptoms at all. Studies seem to suggest that between 30 and 90% of people after, which is obviously a wide ballpark, after infection will have some sort of symptom. Predominantly symptoms of acute HIV infection are a very high temperature, very severe sore throat, and a whole body rash simultaneously. So all those things together.
Who should I see if I think I might have HIV?
If you've had unprotected sex and you have a concern that the other party was HIV positive and you may become infected, then it's really very urgent to discuss that with a doctor or a nurse who's used to talking about HIV. The reason for that is that early HIV infection, we think we can terminate by using post-exposure prophylaxis. And to do that effectively, then you need to take that within, ideally within 72 hours, preferably as shortly as possible afterwards.
What are the different types of HIV test?
There are many different types of HIV test. They probably all center still around the HIV antibody test for HIV-1 and 2. There are more sophisticated testing devices which will now allow us to diagnose HIV early. In particular, there's a test called the HIV Duo, which uses a combination of HIV-1 and 2 antibodies and a core viral protein called the P24 antigen. And if you use those in combination, then you can get a very accurate result at around about 28 days. That's very important because we know that the bulk of the new infections arise from contamination from people who've only recently become infected themselves. So the earlier the diagnosis, the earlier we intervene in the forward spread.
What happens during an HIV test?
There are different ways of doing it. Most commonly we use blood. It is possible to use a saliva sample, and it is possible to use urine testing, but most commonly we use blood. We take a small sample. We can either send it to the laboratory, and the laboratory will do a particular sequence of testing, or there are very quick, what are called on-site tests, which will give very accurate results using just a tiny amount of blood, and people will have their result in anything between 1 and 15 minutes depending on the test device.
How long does it take to get the results from an HIV test?
HIV testing has changed enormously since I started practicing. So in the very old days we used to take a sample and then send it off, and maybe the answer would come back in 3 weeks. Nowadays for an HIV duo test, which will give us a reliable result after 28 days post possible exposure, then we should be able to have that answer, the test result, within about 4 hours. For a standard antibody test, which uses what's called a 90-day window period, i.e. the period between possible infection and the time to test, we can test using a variety of different devices made by different manufacturers and have the result between 1 and 15 minutes afterwards.
How is HIV treated?
For people who have been recently diagnosed with HIV, there is a range of different options. Now, for many of them, there's no need to treat at all. But as time has progressed, then we found that the treatment thresholds that we previously adopted were probably not the best. And so the tendency is now to start to treat people earlier. And we start to treat people earlier for 2 reasons. One, we can limit the spread of the disease, and secondly, the treatment options are much more palatable, much more acceptable, much less inconvenient than they used to be.
How do I protect myself from HIV?
To avoid getting HIV, you should use a condom for penetrative sex. If you don't use a condom for penetrative sex, that's when you'll get HIV. It's as simple as that.
www.busybox.com